Hi, everyone. It's Dr. Arlene Diamco, the MultiDimensional MD. Thank you so much for joining me again this Wednesday. And as always, I love to bring the intuitive aspects of health back to medicine in practical and tangible ways so that you can access deeper healing and more peace, love, and joy in your everyday lives. So every week, I will kind of sit and meditate on what to talk about. And today, I thought it would be really great to give you a behind the scenes look at my practice in All Worlds Health, because I've had the honor of having Lori Rincon here, who is a fourth year medical student at Philadelphia College of Osteopathic Medicine. And she has a huge interest in mental health and medicine. She's been interning with me at my practice for the last week. And it's such a great opportunity. This is something that I did not get to do in my training because my background is a little bit different. As an MD, I did different kinds of rotations. And so to be able to rotate with different kinds of physicians doing hands-on osteopathic treatment and being able to visit all kinds of people working in mental health and with the emotional field is so fascinating. And so I just wanted to invite her here onto this podcast to share what she's learned in the last week, any gold nuggets of wisdom, and give you that sneak peek behind the scenes. And then anything else that you'd like to share in terms of like what you've learned on your medical osteopathic journey and looking at mental health and how you can help people in that way. So just tell us a little bit about you at first, like why are you interested in mental health? Because it's not something that is necessarily the most popular specialty, I would say. Maybe things are changing, but when I was going through medical school, psychiatry and psychology and those fields weren't the most popular. Maybe one person in the whole class of 100-something went into the field of like mental health. Yeah. So,
well, thank you for having me.
Yeah,
I'm very excited to be here.
Absolutely.
So I guess mental health for me has always been a priority. I was a child, I was just very curious and understanding people and understanding who we are and why we do the things that we do. And it came pretty evident to me that our emotions are a huge driver for the way that we live our lives and the way that we interact with people. And in that, it starts affecting our habits in terms of like how we're eating, how much we're participating in community, participating within ourselves and in our spiritual aspects.
How old were you when you first, like when you just had that idea of like, wow, emotions really, like, can you remember the first time you had that?
I was about 12.
Okay.
Yeah.
Okay.
I was also pretty nerdy and very interested in like chemistry. And the most that had been exposed to mental health was kind of the whole biochemical aspects of it. Like, oh, there's like neurotransmitters and it's all chemicals that are affecting the way that you're behaving. And that's kind of like where I started to explore that. But I quickly realized that's not it.
Sure. Yeah. I feel like it was the same age. I noticed things earlier, but in terms of being able to like verbalize things, I feel like I was around the same age when I started to realize that no matter how old you were, so even adults had their own things going on. So it wasn't a matter of age that determined your maturity. It was so situational, and there was a lot of background to how people behaved. And I remember having those thoughts like around that age too. So that's really neat.
Yeah, absolutely. And then I guess within the scope of medicine, I went into osteopathy with an open mind. I considered going an allopathic route, and I also considered the osteopathic route, but osteopathy really resonated more with me in terms of just having a more holistic perspective of not just having pharmaceuticals in mind, but also having lifestyle in mind. And
did you know any osteopaths?
No, I actually grew up in Florida, and there are not many DOs in Florida. So it was definitely a new world for me once I came up here.
Okay. Yeah, because I remember when I was applying to medical school, I had so many envelopes and pamphlets coming in to just have you apply. And then I got one pamphlet from an osteopathic school. And so both of my parents are physicians, MDs. And so I remember showing it to my dad, and I was like, oh, what's this? This sounds really great. It's like holistic, the whole person. And he said, oh, you don't want to go to DO school. So that was, at that point, I was like, okay, I mean, my parents are physicians, so I really trusted them. And so I ended up going to MD school. But I love that you followed what you were, what was calling to you.
Yeah, and I think that's been the journey all along these past like few years that I've been in school, is just kind of letting go of the expectations of what it is that I'm going into. And I think by letting go of that, I've discovered so many things that I did not even know existed. And it's just led me closer to the truth, which I really appreciate.
Well, tell me a little bit about your journey. I know you've been doing all kinds of rotations, and what has it been like rotating with different people and learning new things in osteopathy and in mental health?
So my focus is definitely understanding the mind-body connection. A lot of like somaticized disorders and a lot of trauma-informed care. That's kind of like where my priority is at. At my school, we do have osteopaths in a clinic, so I've been able to work with different people, and there's where I saw like, oh, although, you know, in school we learn different techniques and stuff like that, everyone practices completely differently. Everyone has their own gifts and everyone has their own perspective, and I wanted to explore that more. So during my last about like year and a half, I've been able to travel and work with osteopaths on the West Coast and here in Georgia as well. And it's been really insightful to see how different everyone practices.
I love it because it's an art. And so you can learn from anybody and everyone brings like their unique gifts and constitutions and they have different ways of approaching things, but there's not necessarily like one that's better than another. It's just whatever's a good fit for people, like matching the patient with a physician and their approach. So yeah,
absolutely. And I think that's a great point you bring up, because it becomes that therapeutic alliance of, if you're able to connect on that level, you gain trust with the patient, and that in itself can be very healing. To feel understood by your physician is a big change for a lot of patients, unfortunately.
Well, I know you've visited lots of practices, and then you've spent the last week here, and I know it's only a week, but there's so much that you can see and learn even in a week. And I mean, I feel like every day in the practice is miraculous. And I mean, I love every patient that walks in the door and the interactions that we have and their experiences. So I guess being a part of that, like, do you have some just take home points, or the gold nuggets that you've learned from the week, or what would be what's been interesting to you from both perspectives, from a physician's perspective and osteopathic perspective, but also like looking from a patient's perspective as well?
I guess both from the physician and the patient, the emphasis that you place on the self and understanding yourself, that has been definitely changing my shifting the way that I am approaching patients, because I think often we can kind of get lost in like the doing and kind of like merging with the patient, and like, okay, I give it too much importance of like what it is that I need to do. But coming back to like how you mentioned, coming back to my own essence has really opened my mind as to, although we are connected, coming back to yourself can really just like open up space to just allow things to happen in a way that is more pure, I guess.
And that is on both sides, because the emphasis, like with me, with the patients, and then even in teaching like other physician practitioners, osteopaths, or other kinds of integrative practitioners, it is really on the being first. So the being, then the doing, and then in the doing, you can have whatever it is that your desire in your life. But it's much easier to approach things that way. It can be more difficult at first, because it does require you like taking a look at yourself, like going inwards. But if you start with the being, it makes the doing so much easier, and it makes whatever you want to create or have in your life so much easier. If we start with the doing, but we don't have the being, we're always working uphill against ourselves, because we're not starting from a foundation of where we are. So that's why I place so much emphasis on the being and then the understanding of the self and of your symptoms, of whatever you're going through, because it brings so much more meaning to your life, to even the suffering or whatever you're going through, the challenges. It's like, can we broaden the perspective to have more understanding of what the experience is and what your being is going through.
Yeah, exactly. Being able to connect that external occurrence or whatever it is happening to your body, but also like what's coming in from the inside that's reacting to that, or maybe at like the core of all that.
Mm-hmm.
I think that's also a huge part, is like finding the core. So many times it has been something that is emotional, and albeit traumatic, can be like a subjective experience, because we've seen people who have intense childhood traumas, and we've also seen people who don't feel understood, or that their perspective isn't valued. And that in itself can also be a trauma that kind of like closes the self in.
At any age.
Yeah, at any age.
Yeah. So it's been neat to see, like, we adults feeling that way, but even kids like feeling maybe out of place or misunderstood, or they have stressors that aren't readily apparent, because anyone can have like their outer external appearance, but it's like what's on the inside, and then there can be incongruencies too with what you're seeing on the outside and versus like what they're feeling on the inside. So aligning that mind, body, spirit experience so that a person has awareness of both. Like, this is how I feel on the inside, even though they might look calm, or they might, they could go through all kinds of things. We've seen kids with ADHD who've been, they look like they don't have focus, that they're really hyperactive. Maybe some of them are having tantrums. And really, they're super stressed out. They are in a fight or flight reaction. Maybe they've had a birth trauma, which may not even be that apparent, but there's something difficult about the birth. Sometimes just getting squeezed out of the birth canal what it feels like to me, becomes like a post-concussion syndrome from birth, which is not something that people will commonly name, but it's something that can affect you for many years unless it's addressed. And there's many ways to address it. And that's been kind of the fun of it, being able to see that and seeing families feel more empowered, kids feel more empowered, parents feeling more empowered, and being able to understand that, no, this is not necessarily who they are. Like, all their behaviors and emotions aren't who they are, but it's these stress patterns that's making the nervous system really feel like it's on high alert. And so then everything is getting their attention. Just like if you're a Marine at war, everything gets your attention to keep you alive. But if you're a kid or even adult and in that fight or flight state, then it can really look like hyperactivity or lack of focus. So that's just an example of like some of the things that we've seen this week.
Yeah, and it's interesting that many people can come in with that same diagnosis of ADHD, but feel so different.
Sure.
And the reasons why they are having these symptoms or like these difficulties are very different and unique to each person.
Yeah, and that's the understanding of it. And that is not on the ADHD forms. And knowing how the ADHD workup goes, I don't know very many avenues that have that understanding. Maybe if they had a really good counselor or someone to be able to kind of draw those things out. But I would say that most people diagnosed with ADHD aren't in counseling. So they don't even know to explore those other sides that might have left them in this fight or flight pattern.
Yeah.
So,
yeah. And I do really appreciate that you do give them a sense of empowerment as well, that it's not, they have this diagnosis and they're stuck with a diagnosis, but rather that they can explore themselves, and you give them homework that gives them the chance to do that themselves, like an understanding of themselves.
I love homework for people. And homework is not the kind of homework you had from school, because it's like, usually when I have people do something, there's actually something kind of fun about it. It's relatively easy. And it requires them getting to know themselves in some way, shape, or form. But it's it's not necessarily always huge lifestyle changes. I usually give people a small thing to do consistently. Yeah, sure, sometimes people will have to make some big dietary changes, but we don't always do that like all at once. And I do focus a lot on the mind-body aspect, understanding emotions, understanding of the self. And so their homework will have something to do with that, of how to get to know themselves. I mean, one homework I've commonly given recently is just being able to express yourself safely. So so many people can't verbalize how they feel, or they can't articulate, every moment, like how their body feels, how they feel. So I give them another way. So for example, I do this for kids and adults. I'll say, just think of an animal that represents how you feel, and then either pretend to be that animal or imagine yourself being that animal, in the way it moves and the way it growls or makes sounds or whatever noises it makes. And then it gives them a safe outlet for whatever they're feeling without having to overanalyze how they're feeling. So that's not the only thing that I'll give people to do, but it's just a simple example of the kind of homework that people might get. So they'll have like their animal diary, or just do that once a day. Yeah. I know you've heard me say that.
Yeah. And although it is simple, it's also obviously very effective. Like once you do kind of bring up this meditation for them, you can see the shift in their face. Like it's evident how everything starts kind of moving for them.
Oh, that's neat. Yeah. I love that you notice that. Mm-hmm. You can notice it while they're doing it.
Yeah.
Right?
Yeah. Absolutely.
It's like you can feel the emotions sort of like bubbling out. Mm-hmm. And then, and since you're monitoring from osteopathic perspective, you can actually see the shift mm-hmm. in the rhythms of the body mm-hmm. and the flow of the body, that there's more flow, and their faces will light up, their eyes might shine more. So it's really neat.
Yeah, it's been a very insightful experience being able to incorporate that, and also the fact that you give people this safe space to have these expressions of emotion. I guess in my past rotations, often patients will come in with more so a physical complaint, and the conversation will be more so on the physical trauma that led to the injury or something like that. And patients won't necessarily talk about how that injury is affecting their lives, how it's affecting their relationships and uh-huh. their fulfillment. But there's definitely a sense of openness here, where I feel that patients you don't have to ask, they just bring it up.
Yeah.
And they know that it's a place where it can be expressed and it uh-huh. will be addressed. Like they will be uh-huh. seen.
Why do you feel that is? I mean, there's so much I could say about this, and I did a whole podcast on like how to create an emotionally safe space. But like what, like I'm so curious, because as a student and like looking into my practice from the outside too, and then being in the practice, and like what feels different, and why do they feel safe to express more?
I think initially it's almost like the expectation of it. Mm-hmm. In the intake paperwork, you do give space for that, for the expression of like, uh-huh. how do you describe yourself? Or like, is there any big stressors in your life? And that's not something I commonly see in intake paperwork. So I think uh-huh. patients get this perspective of like, oh, she cares about who I am and what is actually happening in my life, not just how are my uh-huh. bowels doing.
Sure.
So I think just from that like perspective of like, okay, this is a place where I can talk about these things. Uh-huh. But also when you do invite a new patient in, it's a very like open space. You're not closing them in by asking them very specific questions. So they're just able to bring up whatever it is that is bothering them.
Uh-huh. That's really neat. I love that you notice all that. And some of those things are relatively simple changes that you could make. So if you're a practitioner or osteopath or a physician, to be able to include that. And if you're someone looking for to work with someone like that, that you can maybe express interest in talking about those things that are really important to you, because we're human beings, and any experience you have, even if you've had a physical accident, it will have a mental, emotional component to it. it's impossible not to, because you're a human being, so you're always all of those things. And if you have a mental emotional thing, it's going to affect you physically. And we see that, feel that in the osteopathic assessment and treatment. We see how it contributes to like the stuckness. And but those things, just even changing the intake form, I mean, that's relatively easy, because that's something I was wondering, because so Laura took the first course with the Dig On series, which is this series of osteopathic courses that we're offering to physicians and osteopaths. And it's learning how to feel the emotional body. And so I was wondering, I was like, having been here and taken that course, like, oh, well, how do you see yourself like incorporating these things into your practice later on? I know that you're still going to be going on in training, but one of those things you already mentioned is like, well, included in the new patient form, the intake form. So give a space to express, give the patients a space to express themselves from the very beginning, even before they've met you. And because sometimes I feel like physicians and other practitioners, especially in the more allopathic world, they feel like incorporating these things is difficult. But getting to know a person, even if you just include it on your intake form, that is not difficult. That's giving people an opportunity to speak, to express themselves. And maybe they haven't had that opportunity before. And I've seen that, because like the people might be surprised, but in a good way, that you care about the way they feel mentally, emotionally, not just physically. Like you care about their being, you care about their dreams and their hopes and wishes, and how that comes into play. I mean, we saw that with those kids and that were sick, and it turns out like there was a stressor in the family. Somebody else, there was a situation, nothing like horrible, but it had stressed the kids out, and they had manifested it in different ways. Like they both had illness, but one had manifested it more physically in terms of illness, and one had a mild cold and had manifested more emotionally that kind of stress in the family. And so that's really neat.
Yeah, absolutely. And it goes to show like how unique we are, and how, although we can all go through similar experiences, the way that you express yourself is going to be very different. And having that space to express yourself so that it can come out in a healthy way.
Yeah, and there's not a right or wrong to it. It wasn't like one sibling handled it better than another, and that's not how the parents are feeling at all. But it's just understanding that uniqueness, and I feel like the parents really, they love that when you can understand the uniqueness of their kids, and adults, of course, everybody really hopes to be seen and heard. So to allow them to feel whatever they're feeling without a hint of judgment is really key in terms of creating that emotionally safe environment. So yeah, absolutely. So thanks for helping create that in this last week.
Oh, it's been lovely.
Yeah, it's really helped a lot of people. Is there anything else that you wanted to say?
Yeah, you asked how I would be able to incorporate all of this in the future. And I think a huge part that I got from the Dig On series course and just the past couple of days is really keeping it present that the dimension of like the emotion can be something that will be the rate limiting step to a treatment. It's been really insightful to see how quickly things can start shifting when you are looking in the right place. So just keeping that in mind every time that maybe, I work a lot with the fascia, and maybe the fascia is stuck and it doesn't want to move. Maybe taking a look at the emotional body and asking it, like, is there something here? I think it's going to make big changes in the future if I'm keeping that present.
Yeah. Oh, good. I'm so glad that you got that, because I mean, the way I've been approaching things is like, if something feels stuck or quote stubborn, then don't you be stubborn too and keep like working on it. Expand your perspective. Perhaps there's another fulcrum that's more efficient. And so Laura's talking about that rate limiting step, like maybe there's another place that's more stuck, but you can't see it if you're not expanding your perspective to include it, if you're not giving it an opportunity to speak by just giving it a platform with your awareness of like, yeah, show me, what else is there? Because if something's not budging, I mean, that's what we'll teach in the Dig On series. I was like, don't keep pushing at it or hammering at it, or don't just sit there indefinitely. Expand your perspective. Something else is calling. And as soon as you are on that more efficient fulcrum, then you'll start to feel that wiggle room. Just it's so much more efficient. And so what looks like was really stuck and solid, all of a sudden it starts to melt. And I'm so glad that you got to see that, because in some cases it happened so rapidly.
Yeah.
And there were things that your mind might have said like, oh no, this rock will take a lot to work on, where, it will take this many visits, this pretty frequently, every week or two. And then when something melts so much, your mind can start to think like, wait, did I really see it like that? Because how could it possibly be so much more open and free? And this is not to even say that this is what has to happen with every visit, but to be open to the possibility, so your mind doesn't shut down the possibility. Like, when I see something this stuck, it cannot possibly release in one visit. It may or may not. So just be open to all the possibilities and let it unwind at the pace that is okay for the patient, okay for the person. But at the same time, expand your perspective, because there might be another stuck point, that rate limiting step, something else that needs your attention even more so than what you're currently looking at. So yeah. I feel like I could talk forever about this, but is there anything else that you'd like to share?
No, just thank you so much for the opportunity to be here. It's really been an honor to see these emotional releases, or see families and babies, and just the whole range of healing that can happen within these walls. So it's been beautiful. Thank you.
Yeah, so fun. Well, thanks for being here too. It's always great to have a student. Helps me keep a fresh new perspective in that beginner's mind, which keeps you open to infinite possibilities. So I mean, you're coming here to learn, but I also learn from you, like being able to see from another set of eyes as well. So thanks for being here.
Thank you.
If anyone has any questions for either of us, then please feel free to comment, and I'll see that if we can get back to you. And of course, like and subscribe. If you want to connect with me further, you can at All Worlds Health on Instagram, on Facebook at All Worlds Health and Pediatrics. And you can always sign up for my e-love letters. I send them out once a week on Wednesdays. And you can do that from my website, allworldshealth.com. So lots of love to all of you. I believe in you, so I hope that you believe in you too. And I'll see you next time on another episode of the MultiDimensional MD.